Hello and welcome everybody to another Friday wrap-up edition, 3 Pillars edition of Core Wellness TV. Today I'm going to teach you 1, how to be more empowered and more autonomous with your health. Number 2, how to save your back, save your low back by getting more motion through your hips. And thirdly, we're going to talk a little bit about detoxification and the detriment of having too much extracellular water, and we'll talk more about that. Number 1, this is the autonomous thing, right? I'm using people from this week. I'm using real patients, real clients to bring you these stories because this is what comes up during the week. Number 1 is, I had several, a handful, 5 or 6 or 7 new people that came in this week, and we talked about number 1 thing you got to learn when you come in here. This is not passive care. Passive care is when you get something done to you. Yes, I do passive care, right? You have to sometimes get things catalyzed. You have to get, healing has to be catalyzed and promoted through sometimes doing passive care, but you cannot only get passive care. You have to take active responsibility and do your doing on your own. So if you are going to someone, this is the classic thing that gets under my skin. Is I'll see someone and they said, yes, I went to a chiropractor last year. And I said, well, how did that go? Well, I went 3 times a week for 6 weeks, and then I went 2 times a week for 3 months, and then I went 1 time a week, and what did they do? They said, well, I laid down on my back, they cracked my neck one way, they cracked my neck the other way, they rolled me on one side, then they rolled me on the other side, and then they put these electrical stimulation pads on my back and did some ultrasound, and I left. And I said, what did they do actively? They didn't teach anything. They only did passive care. Now, this is better than aspirin. This is better than drugs. This is better than going, the route where you actually are having harmful side effects from medication, but it does not get to the root cause. You have to reprogram your brain and your nervous system patterns so you don't continue to have the problem that you came in with. Active care versus passive care. So that's what will help you become more self-empowered. You have to learn. You have to actually practice new movements and new programming in your brain, or else you will always end up in this dependent, eventually a dependent cripple at the end of your life saying, oh, can you do it to me again, doc? Can you do it to me again? I know I've made a mistake. If someone comes in and says, I've done it again, can you fix me again? Okay, I don't fix people, I teach people, I catalyze reactions, I help speed up the healing process with soft tissue work and chiropractic adjustments, but when it comes down to it, it's up to you. That's how to become more autonomous and self-empowered, is do your own work. And if you're not getting that active care, find someone who does more active care, okay? Now, the other big thing, just actually my last patient of the day today, she came in, she ended up with this back pain after a long stint of gardening, and then after doing many rounds of physical therapy, and actually she started developing this hip pain that started into her back and started wrapping down her leg and doing all this crazy stuff. And we looked at her, and she had pretty good movement everywhere except she could not move her right hip. It was stuck. It wouldn't go into external rotation. Laid her on her back, and I crossed her leg, and it was like this. You've had that. You see, so it looked like this. I crossed the leg, and it was like up in the air. This side was like this, right? This side was like this, right? So, we don't have good hip rotation. If you don't have good hip rotation, especially the external rotation, then you're going to take what's lacking in your external rotation of your hip, and when you walk down the street, so she had pain when she walked. That's the biggest thing. She could sit all day long, take a 3-hour car drive, no problem. But if she gets up to walk, then she has the problem. So this usually tells me that it's hip, not always, but usually. So we went in there and we released some muscles, we released some groin muscles, and we did some work, and we got some motion back, okay? And then I said, okay, what are we going to do now to keep that? Okay, so I said, one of the things we're going to do is now that you have new motion, so now she laid down, now the leg flopped better, a lot more easily. And she said, wow, that's a lot more free, right? She laid down, so the leg flops, open better now, and now, so I've done the passive care. And now she's going to do the active care, where she's going to do the piriformis stretch. You may have seen that before. If you Google piriformis stretch on YouTube, you'll see it. There's like, hundreds of thousands of views on it, where you should sit in a chair, cross your leg, and stretch. That's an active stretch for her. And I said, okay, not only do we need to do the stretch to keep that motion through the hip, okay, we also have to actively work on those external rotators of the hip, so your back doesn't have to do all the work. Remember I said whenever you walk down the street and if your hip can't go into external rotation, that motion's got to go somewhere. You got to get it somewhere. So what you do is you run into that block in your hip and you end up using your back to make up the rest of the motion. So one of the things we did with her is we had a heavy band, okay, laid her on her back. We put the band around her legs and put it up around her knees like so. Actually, I can get on this thing. Like so. And we just had her just very gently connect her back support zone. If you don't know what the back support zone is, then you need to make sure you get the video series. It's just sign up on the page that says, send me the self-test and exercises, to learn what the back support zone is, because you'll learn that doing baby belly. You connect the back support zone, lift the pelvis just slightly, and push out at the hips. When you push out, that wakes up that external rotation system. So now not only has she stretched it, she's also woken up the muscle that has been asleep. Because whenever a joint does not have a full range of motion and it becomes blocked, then the brain becomes disconnected to it. You develop kind of an amnesia of how that joint works. Now that she has new motion through her hip and she's waking it up and she's bringing her brain and her hip back into connection again, waking up from her amnesia of how that hip works, now she's not going to have to use her back as much. Now, we'll see, we already, just after getting up, she said it was already felt different and it was freer and it felt like she could actually bear weight on it again. So there was an immediate shift and change, but we'll see, as it comes down the pipe, how she ends up doing. But I said this is not a one-time thing. You probably had this hip problem for who knows how many years, 30 years, who knows, right? She was an active athlete, she did all kinds of stuff, had lots of ankle sprains. A lot of times if you have an ankle sprain or any kind of foot pain or dysfunction, you'll often have dysfunction up that same hip, and that will, kind of get blocked and it won't go through full range of motion. So there's lots of things that can happen that can block your hip and make your low back hurt. So take home there is make sure you can do that test. Just lie on your back. It's called the Patrick Faber's test. It's a real common hip test. Lay and see if the hip will just lie open. If it doesn't, you can try the hip stretch, the seated piriformis stretch. I'll put a link to that down below. And then also try the bridge with the push out into a band. Okay, you can get bands like that at usually any fitness store or even Target or whatever, wherever you are. Most people, you can find a band somewhere, exercise band. It has to be really heavy though, because it's a really strong movement to push out, because it wakes up your hip external rotators, your glutes, and some of your deep muscles. So that's the physical piece for today. Lastly, the nutrition piece. This other client, this is classic, okay? She came in, she's been doing this boot camp and this physical fitness, getting back in shape, wanting to, she's just got to get herself strong and get back in shape and start losing weight. And she's been doing this fitness boot camp for at least a year, maybe, I can't remember, but a significant amount of time where she should be dropping weight, right? But no weight loss, no stubborn weight gain, right? It's not going away. So upon history, what do we find out? We find out lots of estrogen dominance related problem, uterine fibroids, had to get fibroids removed. Lot of bad, hormonal symptoms, mood swings, things like that. Sweating, sweating too much, retaining water, retaining fluid. So what we did is we measured her with a bioimpedance analysis, which gives us an idea of how much water is on the inside of your cell and how much water is on the outside of your cell. The water should be on the inside of your cell. Most of it should be on the inside of your cell, or at least 60% of it or more should be on the inside. and the other should be on the outside. So because we want our cells to be healthy like grapes. Okay, if we spill water to the outside, then our healthy cells look more like raisins. Okay, so what we found out is she had an extra almost 5.5 liters of water that on the outside of her cells that wasn't supposed to be there. Imagine having two 2-liter bottles and pouring it in your cells, and carrying around that extra water that doesn't even need to be there. Now, whenever that water is on the outside of your cells, it compresses arteries, nerves, and veins and doesn't allow good flow of nutrition, of oxygen, right? If it compresses your arteries, it's not going to let oxygen get to your tissue. So if you have all this extracellular fluid, you're going to feel like stuff's going to go numb, stuff is going to be pinched. Classically, like if you're pregnant and you start retaining some water and fluid towards the end, you get carpal tunnel because you get a impingement of the flow of arteries, nerves, and veins that go down to your arm. Okay, so if we can get rid of this extracellular water, we can unload the body and get rid of some of the symptoms that she's having. Now, how do we do this? Detoxification. That's the number one thing. If I see that much water to the outside of the cell, I know the body's toxic, because this is the deal. The body has a solution to pollution, and it's dilution. So what happens is your cells actually give up the water that's inside of them to try to dilute the toxins so the toxins don't kill you. Okay? So I've done this, I don't know how many times, where we've done the detox program, and immediately, like the first week or two, we repeat the bioimpedance analysis, and we'll see like liters and liters of water just gone. And weight drops just because all of that extracellular fluid is gone. All of that water that was on the outside of your cells, smashing on your arteries, nerves, and veins, and decreasing oxygen to your cells, making you hypoxic and tired and achy and grumpy, all that goes to the outside. All that extracellular water, you just get rid of it because your body starts getting rid of the toxins. What do I use? I use Ultra Clear Plus by Metagenics. I've used it for years. It is research-based. It's on peer-reviewed medical research on this stuff that proves that it increases the liver's ability to get rid of toxins in your system. So I use a medical food along with a modified elimination diet where we get rid of basically wheat, dairy, and conventional animal products and eventually animal products all together for a period of time, to where we eat basically as close to a vegan and close to a raw diet as we can I usually do it for about 3 weeks. And we push this pattern through there. We do the shake, and we increase these nutrients to the body. It gets rid of all of these toxins in the body. The weight drops off, the energy goes back up. Although after there's a little bit of dip down first, people usually have this sense of, oh wow, I start feeling fatigued, a little achy as the body starts going through the detox process, but usually that lasts for a week or a few days, or depending on how toxic you are. And then you come out on the other side of it lighter and happier and more energetic. So that's what I use. I use Ultra Clear Plus along with a capsule that has additional detox nutrients in it, like pomegranate and geez, what else is in there? There's there's all kinds of stuff in there. But anyway, it's a additional capsule I use to help to buffer the detoxification process. It's called AdvoClear, and we use AdvoClear and Ultra Clear together for about a 3-week period of time, and we have amazing results. That's detoxification. We give the nutrients the body needs so it can get rid of it. All right. So that is the 3 pillars talk for today. Hopefully that was helpful to you, right? Now the detoxification, I know I used a product instead of going straight over here to using, doing like a juice feast or something like that right off the bat. But I know that this is an easier step for a lot of people to take at first as they transition into getting more greens and start juicing and using green smoothies and things. Sometimes the shake is a first step and is a doable thing for most people. That's why I use that first, and as we introduce all of the new beautiful raw and plant-based diet into the system. So that's that process. So that's it. Think active care. Think hip rotation and hip external rotation exercises to save your back, and detox. Detox, detox. Green foods. If you want to do a 3-week cleanse, you can use the Ultra Clear and Clear products. They work beautifully, beautifully, beautifully. So have a great weekend, and we'll see you next time. Bye-bye.